NCLEX. So you know that NCLEX love this sequencing of donning and doffing our PPEs, right? PPEs, right? And so don't forget this sequence because this is an NCLEX hot topic that for sure is a high yield question that are more likely are going to show in your exam. So this is the sequence. So when you're donning, the word donning is the letter O-N. When you're putting it on, the first step is the use of the gown, the mask, the goggles, or sometimes they're going to use the terminology face shields. And the last thing that you put on is the gloves. So think about this when you're doing it in an actual clinical or hospital setting. So the first thing you need to do is you put the gowns on, you put the mask, and then you put the goggle, and then you put the gloves. So gown first, you put the mask, you put the goggles, and you put the gloves last. However, when it's going to be taken off, so the word doffing, see this word over here is off, O-F-F. When you're taking it off, it's exactly the opposite. So taking it off is reverse. Think about that. It's reverse. So the first thing you're going to take off would be your gloves. So picture this in an actual hospital setting. You take up your gloves, take your goggles, you take up your gown and your mask. So gloves, goggles, gown, and mask. Now, I don't know if you notice in the doffing off, these are alphabetically arranged. So it's G-L, G-O, and G-O. So G-L, G-O-G, and then it's G-O-W. And the last thing is the mask, okay? So remember this sequence because guess what? NCLEX loves this sequence. The other thing I also want to emphasize, if you have time, you can look at my CRAM guide. The other thing I want to emphasize is this section over here. So if the patient has C. diff, the best answer is soap and water to get rid of that pores, right? The next thing is if the question asks whether the patient to be assigned to a shared room, you have to remember never pair airborne or droplet with anybody that has immunosuppression. Chemotherapy patients, right? Neutropenic patients. You don't want to combine them together in a shared room. The other thing is if the question mentions transport, always remember put the mask on the patient, not on the hallway staff. Those are some of the scenarios that they're going to ask you. And then last but not the least, if the disease is new onset, such as fever and rash, immediately isolate the patient until proven otherwise. So remember this, okay? So like I said, CRAM for NCLEX if you have to do it, but these are the sequencing that you need to know in terms of PPE. Share this video and follow or subscribe to this channel. I have in the description CRAM guides that you can avail of that talks about high yield topics on the NCLEX exam. Thank you.